feel-good legislation is, yeah, ban guns, restrict guns, control guns, background checks. Like, okay, let's ask what the goal is.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
If you enjoyed this video, be sure to check out my book, The Woke Mind, The Twisted Psychology of the Social Justice Movement, available on Amazon. Welcome to the Reality Therapy Podcast. We're here today to talk about guns and mental health, and so I'm going to let the panel introduce themselves. Let's start with you, Mike.
My name is Michael Sodini. I am the founder of Walk the Talk America.
I'm DB Palmer on the advisory board with Walk the Talk America.
And Jake Wiskerchen, marriage and family therapist, fan of dogs of all sizes.
Michael, why don't you tell us a little bit about this organization that you founded and its origin story?
Sure. I'm originally from the firearms industry, third generation firearms industry professional. And what I saw from being in the industry for so long and my family in it is that there was a need, there was a hole there when it came to negative outcomes of firearms. Felt like we were always being blamed for them. We always blamed mental health, and then nothing ever happened. So in 2009, the president of my firearms company actually took his own life. And that really, really hit home, obviously, because he wasn't just the president of my company, he was my friend. But we had had numerous discussions about how suicide was such a force in our industry, especially when it came to like combat vets, active duty military, and first responders, which are the people that if anyone ever goes to say like the SHOT Show or the NRA show, is the people that we hold near and dear to our hearts, right? We respect them. But we always kind of talked about how it's really interesting that we don't talk about suicide. We don't have these outlets for our mental health. And then obviously 2009 tragedy hits, he takes his own life. It was very difficult for me because this is a person who, and I think later on in this episode, we could probably talk about this. People like Jake and DB are way better equipped to talk about it. But I would have never expected that out of my friend, because he used to tell me suicide's the coward's way out, right? So we would kind of observe this issue that the industry had, but we kind of observed it from the standpoint of, well, that would never be us. And he did that. Now, that's not the reason why I started to Walk the Talk America, but cut to 2018, it weighed heavy on my heart. And I always thought, like, what is there something that we can do as an industry? I had a chance meeting with a lady who asked the question, how does the industry work with the mental health community on the things they can agree upon? And at that time, I was like, hey, we don't, right? Because it goes back to the whole, everybody blames us. We blame mental health. Nothing ever happens. And that's really what started the organization. It took off from there. We basically look for solutions to negative outcomes of firearms, and that means every negative outcome of firearms. So Walk Talk America will address suicide, will address negligence and irresponsible storage. We will also address inner city youth violence, right? So we have something for everybody. And basically, if you're a gun owner and you don't want to compromise on how your stance on the Second Amendment, but you also want to support mental health, then our organization is that organization. And I think that's my mic drop. That's my mic drop moment.
Thanks for joining, everyone. This has been Reality Therapy with Ryan Rogers.
Jake, DB, what do y'all have?
Well, I came after Jake, certainly. So, I mean, Jake and Mike and the rest of the crew before me was doing such stellar work. I came across Walk the Talk. I don't know. I was probably an interested search. I was looking for resources on the mental health side, something exactly like what Mike had just shared. I mean, there must be some entity that's providing education, advocacy. There must be something that's bridging this gap. And so I think I came across it fortuitously. And then I reached out to Mike and Jake and said, hey, first of all, this looks fantastic. I mean, I'd love to throw my hat in the ring to do whatever. I'd love to be there when you guys do stuff, love to hear more about it. And so for me, I'm a mental health clinician and professional counselor licensed in a few states. And this has been certainly my, on the mental health side is my career. I've been at this for, a while. and also a firearms guy. And so, to me, I didn't, for the longest time, I didn't get that there'd be an issue between the two. And I was seeing two things kind of moving separately. And it was probably around 2020 or so when it kind of, it came to enough of a head, politically and sociologically, that it became very apparent that, okay, there's a thing here between the say mental health industry at large and the firearms community. And what I had known from working in the firearms side of things, the military and law enforcement and first responders, was that it wasn't coming from that side of the industry. In fact, I was working with tons of law enforcement who are working with mental health stuff, and they were expressing to me that the industry has really made leaps and bounds within their communities to normalize and to have the conversation with mental health folks. Hey, go talk to somebody. It's all right to get yourself checked out. And I know that has not always been the case, certainly not. But the mental health side of the coin was not making a similar stride. In fact, they were doubling down on opposition, as far as I could tell from inside, toward the firearm community. And that really stood out to me when I found Walk the Talk, was this was a group openly having that conversation. So I stepped in at that point.
Yeah, my story is I was lifelong gun owner, came from a family full of cops, and I'm in this profession, obviously. And so back in college, I happened to become friends with a guy named Jordan Slotnick. Jordan currently operates and manages Reno Guns and Range here locally. It's a family business. And he and I, for years, had talked about how we could create some nexus between the two fields, if you will. So, we'd kicked around the ideas of maybe doing family therapy at the range or range therapy, something like that for those demographics we've already covered. And we just never really could get our heads around it, how to fund it, how to advertise it properly, who to reach, etc. So one day he texts me, says, "Have you heard of Walk the Talk America?" I said, "No." So I look up them. I put them in air quotes for the listening audience. Can't see us on video. And them turns out to be essentially Mike running a one-man show with a really cool looking board of directors. And I emailed them, and them wrote me back almost immediately, said, "Hey, this is me, whatever." But the reason I emailed was I said, I had a podcast at the time called Noggin Notes, and I still do Noggin Notes, but this was early 2019. I said, "I'd love to have you on Noggin Notes to talk about this guns and mental health thing." So Mike jumps to it. We record our show, it was, an hour and a half or whatever. And we stayed on the phone for another hour and a half talking about all the possibilities. And at the time in 2019, I happened to be chairing my licensing board here in the state of Nevada. And I'd done a bunch of cool things, bringing us up to speed and making us current with laws and regulations and so forth. And I knew a lot of people. And I said, what would be awesome is if we could create a course for clinicians to take so that they could become culturally competent with what firearms ownership is all about and all its different wrinkles and facets and presentations and demography. So that was about April of 2019. By July, we'd had our first course, and it was attended by mostly Zephyr Wellness employees. That's my company here in Northern Nevada. It was like 14 people or something. And it was me and Mike and one of our board members, Rob Pincus, and Jordan was there. And we did it at Reno Guns and Range. And it was very well received by a lot of people who were not firearms owners, not firearms enthusiasts, but clinicians who were just, interested in learning more. So we did it again in, October or November or something. And another 12 or 14 people, not all Zephyr Wellness employees this time, which was great. And that was also successful. And we thought, man, we're really onto something here. So Mike is in Las Vegas. I'm up in Reno in the north. I mean, for those of you who don't know the geography of Nevada, it's not a close drive. It's about 6.5 hours. But we said, what we should do? We should put on the same course in Vegas. And so we planned one for March of 2020. And we all know what happened in March of 2020. So that one got scrapped. But we were very excited, and we didn't let the lockdowns dampen our enthusiasm. What we did was we pivoted. I happen to know some people at the University of Nevada up here, and they agreed through the CASAT program. CASAT is an acronym, stands for the Center for the Application of Substance Abuse Technologies, and really they do a lot more than that, but they host a lot of CE coursework. So they agreed to host it virtually. And so we did that. And a couple of months later, it took some planning. We got 74 people to attend. And I was like, holy cow, this is really good. So we did it again a couple months after that. We got 230 something. It's like, man, I think we're really onto something. So that was really the launch of the cultural competence coursework. And right now we have a recording. It's 3.5 hours long. You can go to our website and view that, take a little quiz, and it'll spit you out a certificate at the end. So if you're a practitioner listening to this and you want to know what all this gun stuff is about, I really invite you to take that course. It's free. And then there's a part 2 that's also available on the website. And we get a little bit more into detail with some personal stories and whatnot. And then there's part 3, which we sometimes offer in person. That's actual range time where we delve into policy issues and go a little deeper still. So that's been my role over the last several years is, content creation, teaching, whatnot. But what's really cool, and I'll finish after this, is that I, as a lifelong gun owner, was never into the culture, quote unquote, of the firearms community. I didn't know anything about it until I went to what's called a Gun Rights Policy Conference, or GRPC, in 2019. And I got to meet some people from across the industry, retailers, wholesalers, other professionals, instructors, influencers, if you will, the people whose faces you see on Instagram and stuff. I thought, man, this is much bigger than I ever thought. Well, around the corner of the calendar into 2020, I went to my first SHOT show, and SHOT, for the unknown, is or the unknowing, I should say, is an acronym. Also, it's Shooting, Hunting, Outdoors Trade. So it's a trade show. It's like the world's second largest firearms trade show or something. It happens annually. And I walked into there and I was blown away. And I love trade shows. I've been to baseball trade shows and art trade shows and all sorts of stuff, but this was like next level. And then it really hit me. I thought, now I get it. I get why people collect. I get why they trick out their guns to see what they can do. They swap out different parts. They paint them different colors. Like it just blew me away. And so then I realized, man, this firearms community is really quite diverse. And that's usually the takeaway whenever I present to somebody. I always ask, like, what's the one thing you want the audience to know? I said, I want the audience to know that the firearms community is not a monolith by any means. It's, you got a bunch of white guys in their mid 40s or whatever on the screen here, but it is definitely absolutely not that. And I've been on a journey of learning ever since. And so it's been really fun to be a part of this organization.
Can I ask what percentage of Americans own firearms?
It's estimates vary, but it tends to be somewhere between 30 and 35% own firearms. But then when you extrapolate that to people who are in homes with firearms, it's somewhere between 42 and 52%. So really, you're talking roughly half of Americans, or half of your patient demographic, your clientele who come through your door, will be around guns in the home. So we need to be savvy of that.
Yeah, the one. Sorry, didn't mean to cut you off, but so I owned, before I got into this side of I wouldn't say it's a business, right? But, before I started doing this full time, I actually ran and operated and owned a major importer / distributor of firearms, right? And this is a statistic it's a stat that I love to just throw out. Like, it's data I love to throw out, especially when I'm speaking to people that tend to be on the gun ignorant or anti-gun side. We were a very small company in the big scheme of things, but we used to sell 60 to 80,000 firearms a year of 3 particular brands. So I didn't sell Glock. I didn't sell, right? I sold these 3 brands, and I had the right to sell those brands in the United States because I own the trademark of those brands. 60 to 80,000 a year with no law enforcement or military contracts. So if you think about, if I was a small person, the small guy, what is Ruger doing? What is Glock doing? What is SIG doing? It's almost astonishing that we do not have a bigger firearm issue in the United States. From my perspective, when you really think about how many firearms are out there, I always compare it to when I found out how many sharks were in the San Francisco Bay when I grew up swimming in that thing. It's pretty remarkable that we don't have a bigger issue for as many that are out there.
So the reason I asked about number of homes that have if it's close to 50% that homes that have firearms within the mental health community, and DB and Jake, y'all are in this community, there's a huge bias in our world, And I think so many mental health practitioners would hear that there's a gun in the home, even without any suicidal ideation or homicidal ideation, just knowing that there's a gun in the home would kind of be a red flag for a lot of mental health practitioners in and of itself. How do y'all deal with that?
Are you nodding to me? Is that what the
Anybody can
eyebrow is there?
Not
DB,
you.
I was looking at DB. So going back to when I first had this idea for the cultural competence course, I went to the various other licensing board folks in the states, the executive directors of the board chairs, and I said, hey, I've got this idea. I think you should approve this course as, valid curriculum. And I got one, yes, absolutely, that makes complete sense, because that person was a firearms person also. The others were, shall we say, suspicious. And so then I spit out the statistic. At the time, all we had was a Pew Research survey from 2017 that suggested 42% of people had guns in the home or were around them. I said, I don't think we can afford to be ignorant of this topic if we're going to be mindful and competent in handling potential crises in the office or in the community where firearms are involved. And it was like, yeah, you're right. Like we can't afford to not do. We're in Nevada where it's not 42%. It's probably closer to 82%. So that was a slam dunk. So when people ask that question, I say, look, you got to treat it like any other lethal object. Now, we tend to tilt more toward the firearm as more important, I guess, or to pay attention to it more because it is the most lethal, right? It's less likely that you're going to recover from a gunshot misplaced than you would if you take too many pills or try to end your life some other way. So it is, often referred to as the most lethal means, and we have stats to back that up, of course. But you can't be afraid of it, because the flip side of that is that most people don't use their firearms to cause harm to others. They use them for many, many other purposes. And we have to be cautious of that, just like swimming pools. You hear about the swimming pool and some young kids in the home. You're not going to go, what do I have to do? Should I call CPS? You go, no, what you do is you presume that there's safety mechanisms in place. And the default is that they're owning the pool responsibly. The default is they're owning the firearm responsibly. And so we have that conversation, and then it tends to assuage a lot of those fears.
I think a big challenge within our industry is that the mental health field, across the spectrum, from social workers, psychiatrists, psychologists, all of the different stripes, present one of the most, I won't say the most, but one of the most well understood, to be antagonistic. And I don't understand particularly why there's a trending towards, well, I think it's because we do kind of, my team, your team dynamics, which I think almost always sets people up for missteps. But within that, our field is one of the most, left leaning. I don't mean Democrat Republic. I mean left leaning fields within any professional credentialing, and that's something also well established in just grab AI and do a search, political affiliation of mental health field, and you'll get some numbers that are pretty astonishing. And so that tracks right along with this same dynamic that, okay, well, this must be bad. And so I must assume that this person has, is irresponsible because they're not on my team. And I do want to come back to that piece just briefly, because I would firmly say that firearm ownership is not a left-right concern. I would hope that it isn't. I would hope that it's very much an American concern, very much a universal human resource. I think that arguably that's what our founders exactly said, was this wasn't about the establishment of our government, but this was an establishment of human right. So why it tracks that direction is maybe a whole other podcast, but the field firmly takes a stand against firearm ownership and is very antagonistic to it. So I've sat in conference rooms, 100 folks, and I had my guns and mental health sticker on the same computer that I'm doing this from. And I just kind of open that thing up as I'm taking notes, and you wouldn't believe the amount of kind of side eyes and odd conversations. But once again, like Mike and Jake are so good at, it's about getting that first little conversation going, that this isn't about some kind of chest beating or any of that stuff. It's really about common appreciation of our rights to protect ourselves. To obviously we want to talk about the hunting, that side of things, but to defend ourselves and responsibly train. So I think that first conversation tends to go fairly well once we can get ourselves in the door and present ourselves as normal people.
Yeah, I want to ice that cake just a little bit. The part of the diversity I was surprised to find, because I had my own biases entering into my very first SHOT Show, is that there are multiple clubs and organizations, and they've only grown in number since then, because it's been, almost 6 years now. Liberal gun owners, Liberal Gun Club, Pink Pistols, Armed Equality, and then the various minority-specific clubs like African American Gun Owners Association, Black Gun Owners of the Oakland County, Oakland Alameda County. They've since changed their name. It's like Bay Area Black Gun Owners, and so on and so on. Those demographics have only burgeoned, and the club participation has burgeoned because, unfortunately, they're the ones who are continuing to reach out to Walk the Talk America, because they themselves don't trust our field, even though we would presume they'd be politically aligned, because it's not about politics. So the suspicion between and among communities is very palpable, and that's what we're trying to address, is to bridge that gap between firearms ownership, irrespective of demography or political affiliation, and mental health care access, because we believe that even though we're a suicide prevention organization at our core, if we can get upstream from that and teach people how to stay well, then they don't have to come in and seek counsel. They don't have to slide into that moment of despondency where they become suicidal. But if they do, they're welcome, right? And we want to be able to just flip through the directory and find any willing provider who's not going to judge the individual sitting across from them, and the first instinct is to take their firearms away in a time of crisis. And that may not be the crisis with the individual. It may be crisis in the home with an angsty teenager or whatnot.
So I'm wondering if we could flesh some of this out. I think that's a really good point to make about kind of the underlying political tones, because even though there's a lot of liberals who own guns, it's kind of understood that guns in the gun community is kind of right-wing coded. And even though there's conservative therapists, it's kind of understood that therapy is kind of left-wing coded. And so when I put these two together, like, even without fleshing out why exactly I think this way, I think, gosh, these don't go together, because of that underlying political divide that's kind of assumed to be there. How do you deal with that? You've already gotten into a little bit.
Mike, you want to take this one? Because you've been dealing with the research community, and I think they were the most outside the gun fold, and not necessarily because of politics, but yes, also politics. But you've had a lot more contact, I think.
Yeah, it's for me. First off, when I first started this, it was my people, the Second Amendment community, was a lot tougher on me than I would say people outside of the Second Amendment community. The knee-jerk reaction from, I guess you could say, gun owners was, oh, here we go again, another guy blaming the gun, right? Not realizing, like, hey, I've armed more Americans than everybody in this crowd. Like, let's pause for a second. This is not where I'm going with it. But when you get into that, basically gun ignorant, anti-gun, center-left crowd, I think it's most important, and guys like Jake and DB taught me this, is to validate people's feelings, right? I don't think people, especially on that side, hate guns. I think that their anger is, misplaced towards the firearm. They just hate death. They just hate negative outcomes of firearms, but they don't know how to express it any other way. So, here you have a gun guy standing in front of you speaking, who's saying it's okay to hate guns. It is. It's okay to hate guns. I totally understand that. But the gun is not the reason why you have that feeling. The firearm is just a tool, right? But they don't want to hear that at the time. So you don't necessarily have to go that whole route. But then what I like to do is then say, well, let me show you what the firearms industry is doing for solutions to these problems. And I think that's the big difference, is once you provide those solutions, and maybe those solutions are so out of the box that you realize, like, okay, the firearms industry is on to something. And I truly believe that I represent the firearms industry at every speaking event that I do, every crowd that I walk into. I want people to know that. I make it very clear. So when people say, well, the firearms industry just stands on graves and they just take money and they don't care, I want them to know this is what we're doing. We do it better than everybody else. And in 2 to 3 years, I think we'll be the leaders in this space when it comes to resources and mental health and suicide prevention. So I think it's how well you're received is what type of solutions you're providing. So for, like, just for example, for the listeners and those who can see this, I'm holding up a free and anonymous mental health screening that companies like Ruger, Arms Corps, North American Arms, Bursa, High Point, right? These are all major gun companies, put this in the boxes of their guns. Well, when you take people outside of the Second Amendment community or the firearms industry, they're not going to know about this. Right. And it's our job to let them know that there are companies that are doing this. But when people hear about this, it doesn't matter how you feel about guns. You're going to be like, that's a good idea. Go ahead and tell me that's a bad idea, right? To give people access to a screening that might help them, that might spark their brain to go get actually help and go talk to guys like Jake and DB. So that's how I handle it.
Yeah, I think the challenge is stepping into this space, recognizing that bias, of course, exists. I mean, to that sense, we've all got it. So, I mean, Mike does a tremendous job because he's stepping right into research universities. He's going to conferences and presentations, and no pun intended, but he's very disarming in that because he certainly looks the part of a gun guy, and he goes in there, and the preconceptions that people have about him are quickly dismissible, because just like he mentioned with that flyer, he's not that guy, and a few of us are, we all there's a number of stereotypes that some of us conform more closely to, and I think the less we pay attention or dig, I guess, the more easily it is to apply them. But the challenge for mental health within the field is to recognize, just as we said from the outset, that 42%, 52% of firearms exist within the home. Of households have firearms. That's something like 107 million at an easy conservative estimate of firearms exist, in different households. That's a tremendous amount of firearms. And so we, as within the mental health field, have got to do a better job of recognizing that when we alienate that much of a percentage of the American populace, that we're certainly doing a disservice as a business model. We're losing clientele, but we're doing a much bigger disservice to people's lives, and we're creating this separation that, well, I can't really talk to this guy because then he might think this or he might think that, and unfortunately that perception is largely true. And so it's been the firearms community and the broader 2A community that I've seen make tremendous steps toward the mental health side, and the mental health side is still doubling down. And so a big piece of Walk the Talk and what Jake and I and others are doing within this is leaning in hard that there may be a strong percentage of there is a strong percentage of the mental health field who is antagonistic, but it just takes I guess that's saying it just takes a spark. This spark that we have, that we're working on, we're continuing to fan to flames, and we're seeing more and more clinicians come out of the woodwork and recognize that it's okay to talk about firearms, other than saying, the word red flag or the phrase red flags. In fact, I talk about this regarding suicide in general all the time. When I ask the question, about, have you considered suicide? Have you had thoughts of harming yourself? I say right after that is that I assume people have that thought. I just assume it. I don't assume that that's a negative or unhealthy thought. And every now and then I've had somebody say, gosh, no, I've just never considered it, which I think is a bit of an anomaly. But my presumption and my experience is that most people have thought about it. Whether they've been far along that track or not is another matter. But so that's not a negative presumption. And if they also have a firearm, that's also not necessarily a red flag. The concern is, what else is going on? What are the protective factors? Tell me more about that. And so it's a clinical skill that we use in so many other areas that we need to exercise regarding firearms as well.
I think people may be wondering a couple of things. One, what is a gun box, and what is a flyer doing in a gun box? And I've encountered this many, many times. People have just never bought a brand new firearm before. So what happens is, if you buy a brand new gun, it comes in a box, and in that box is the gun and probably the magazine that goes with the gun and some literature on how to operate it, your federally mandated cable lock. So cable locks are required to be distributed with all new firearm purchases. And our literature is one of those pieces of paper in the box in those companies that Mike mentioned. So that's how powerful it is. It's the first thing staring you in the face. It says mental health. It's okay to talk about it. And you flip it over, and there's some sponsors, and it's the 988 line and the text line and then the free and anonymous mental health screening. So that's one thing. The other thing is people may be wondering like, well, don't you guys learn this in school? And I could say affirmatively that at least, 15 years ago when I was in school, no, we did not talk about guns in school. We were taught to talk about all sorts of sensitive subjects like suicide and finances and sexual orientation and sexual activity and so forth that you don't talk about in mixed company at barbecues and cocktail parties. But I want to ask you, Ryan, because you just graduated, did you get training or exposure to the gun conversation in your schooling?
In 3 years of grad school, the only mention of guns that I've ever had is if you're talking about suicidal ideation or homicidal ideation. The only time you would talk about guns is if you potentially need to take them away.
Right, which is wild because you're in Texas. So what I tell professionals when I'm training is I say, change your language to, if you have somebody who's suicidal in front of you, you've scaled them, they're at an 8 or whatever out of 10. You say, how are your guns stored? Don't ask if they have guns. Presume they do. And if they say, I don't have guns, okay, we move on to the next topic. But if you ask, do you have guns? And it's a gun owner, they're going to get suspicious immediately. Now you're not talking about the suicide. You're talking about property restrictions, right? So that's what I invite people to do, is just presume that there are guns in the home and ask them how they're stored. And then you can have a conversation about storing them responsibly, changing the code on the safe or whatever, or getting them out of the home altogether. And we don't have to involve the government and law enforcement. So that's one thing I would throw out to the audience. But there's a flip side to this too, and Mike's alluded to it, is the suspicion from the firearms community itself. So when he starts, talking about screenings, the initial response is, oh yeah, well, you're collecting my data. Where's it going? Right? Who's watching? And that's not true. That's why they're free and anonymous. Most people like free, and the gun community certainly likes anonymity. So that helps assuage a lot of fears, knowing that it's just not going anywhere. So part of what DB and I do with these trainings is we're talking to practitioners, but also in those audiences are often, because we hold them at firearms retail stores or gun ranges, there will be instructors in there, and we try to demystify what counseling is so that people can come in. We talk about insurance, we talk about confidentiality, we talk about treatment planning, we talk about how you're not going to be here forever. You'll eventually solve whatever's ailing you and you can discharge and move on just like we would with any physical ailment. So that helps warm people to the idea of asking for professional assistance in these times of need as well. So there's two things going on here, and both carry a burden of stigma with them.
So I want to give you guys a scenario, and I want you to tell me how you would respond to both parties in this scenario. So let's say I'm a gun owner and I am coming to therapy. I'm seeking out help for my mental health. Maybe I have sadness, anger, irrational thoughts, emotional instability, and I own a gun. And I get into the office, it's a 29-year-old woman with a live, laugh, love sign on the wall in her office. And I'm thinking, I don't think I can trust her to tell her what's really going on. How would you respond to both parties in that situation?
Well, I mean, she's the person is making probably a fair assumption that this is probably therapist light or therapist basic. And they've kind of walked into the curated office version of this whole thing. And so, yeah, I'd be responding to that person's distrust with, respecting that and having a sense of, yeah, it's, we have this gut feeling sometimes where we want to respond to that and recognize it. I'd say that, there are a number of clinicians. Of course, I'd be recommending them over onto Jake or to somebody else, and to finding out, where are they, and making sure that they felt as comfortable as you can feel. I mean, it's a hard thing to have a conversation with somebody that you don't know about stuff that's going poorly in life. I mean, that's just an uncomfortable thing in the first place. So, I don't think often I've had somebody show up for their first session with me and say, I'm so thrilled to be here. Like, let me unpack my life for you. Because everything was going so great that I called a therapist. No, the people are coming out of a rough spot for some kind of driving reason. And so the less awkward, the less offensive we can make that connection, the better. And so I'd say, we got to be a good consumer. So do your research on your therapist, find out what they stand for, check if they've got a Psychology Today profile. I'm certainly not meaning to rep that site, but if they've got one of those, check that out. But if they've got a conservative clinical or a conservative therapy, that's two other great sites. And there are a number of other places to find therapists. Um, um, Maybe a gun range would be a great spot to find one. Um, so be a good consumer would be my first thing to that client, and say, talk to other people within the industry. Who do you know? A warm handoff is very, very good. And then, in terms of the therapists themselves, I would be really wanting to be, uh, so yeah, I want to make sure I get this dialed in. You've got um, walk me back through.
Yeah, I mean, just picture a therapist who graduated, let's say in the last year, from a program where gun owners, like when you mention gun owners, there's at least a little bit of antagonism. So that's kind of my mindset going into this therapy appointment.
Right. So as a therapist, I mean, it'd be about just like so many other things. You want to get your cultural competency. And so if I'm meeting with somebody who I have no idea of the world in which they inhabit, I'm probably not well equipped, or arguably the current model and previous models of therapist training would say you're not equipped for this. Like you're not ready for this client. So I'm stepping into a space that I'm ignorant of their world. And so I would do well to get some training in that, or to self-select out that, okay, this really isn't a good fit for me, which is also a fine answer. And so, Walk the Talk does this tremendous 3-part cultural competency within the firearm community. I went through all 3 of those. They're great. And that's just like any other cultural competency that gets you down the road a bit. And then from there, it's up to you to keep learning, keep growing. But that'd be my first answer is get some competency before you go in with you're going to go in with assumptions, but get some education before you just go assuming wildly.
Yeah, for the consuming patient, I would say it would be very weird if the first series of questions, or one of the first batteries of questions had to do with your gun ownership. Now, that being said, I understand that the zero suicide movement has pushed to have this question on all intake forms in many different medical presentations, from dentistry to primary care to pediatrics. And I just don't think it's necessary to ask. We don't ask about other dangerous objects. We don't ask about medications in the home. We might ask about what medications you're taking so that I can be aware of what may or may not be contraindicating your presentation in my session. If I'm a physician, I'll be asking about what medications you're taking, because I want to know what I can prescribe that won't throw you into a downward spiral. But asking at the outset about guns, I think, is quite irrelevant unless one of the 2 topics arises that requires more further exploration, which would be homicidality and suicidality. And then we would ask about means, because that's part of a good suicidal screening is, how suicidal are you? How would you do it? What's your plan? In other words, do you have access to said plan? And then what's the likelihood of executing said plan? So if it's a 14-year-old who's suicidal and he says, I'm going to drive to the Golden Gate Bridge and jump off of it, I go, well, we got a few problems there. One, do you know how to drive? You're 14. Yes, I do know how to drive. What have you driven in the past? The ATV. Okay. Have you driven a car? No, I haven't driven a car. Could you drive a car? No, my parents always have the keys elsewhere. Okay. And now we're getting less likely that this is going to be executed, right? Do you know your way to San Francisco? No, it just sounded like a good idea, right? I'm not going to immediately ask about guns. Now, if he says, my dad's got a gun in the nightstand and it's always unlocked, now I'm paying closer attention. Now I'm going to pull dad in, right? But I'm not going to ask about guns just because somebody shows up in my office for anxiety. I'm going to ask about their anxiety. I don't think the proper level of intrusion is to jump straight to property confiscation. I think the proper level of intrusion, barring everything else, if I just can't talk this person off the ledge, is to get them to a higher level of care. If they need to be referred to inpatient or residential care, then we do that. If I don't believe through my screening that they're going to make it there without taking his or her own life, then I need to have that conversation about properly transporting them. But I'm not going to go send the deputies to their home to start taking property. That doesn't make any sense, and it's totally out of my scope of practice. And that all being said, I know there are states that have empowered clinicians to execute petitions for red flag laws, or otherwise called, extreme risk protection orders or gun violence restraining order in California. So that is on the table, and all it takes is one, and it doesn't matter if the person was sued into oblivion for doing it incorrectly. That story never makes the media. All we hear throughout the community is don't trust mental health, don't trust doctors. So you end up with people lying in the session. So that's the other thing I'd say to the patient: don't lie. Like, your life is more important than anything else. If you have to separate yourself from your property, whatever that be, if it's high places or ropes or sharp objects or swimming pools or guns, you need to separate yourself from those temptations for a period of time, medication even. Then we need to have a conversation about that, because ultimately at the end of the day, I want you alive. I'm not really interested in anything else besides keeping you alive. For the practitioner, exactly what DB said. We in this profession must have an ego humility that allows us to become lifelong learners and check our own biases at all times continuously. There is no arrival point at which we think we know everything about certain people, because individuals are as different as the people walking the earth. So I don't want to make any presumptions about what a gun means in a person's life. I got a neighbor who has a gun and it's never left the box. So
yeah, I think, I'm not a therapist, but when I first started this, it's crazy. I had people that have known me for 15 years, and they knew me as Mike, the gun guy, right? The guy who sells guns. And the minute I started Walk the Talk America, like, the same person that knows I have no idea about mental health, and I'm not, I have no degree in it. All of a sudden, I became like the resident mental health expert of the firearms industry. So I was still working the gun side of things, but I would be walking down a show, and people, it was overwhelming. I was definitely not prepared for it, but so many people would stop me, and they're like, "Hey, you know about this mental health stuff?" Keep in mind, I have no idea. And they're like, "I went to a doctor the other day, and that doctor asked me on a form about my firearms, and I just lied. And I'm not going back to that doctor, but why did they ask me?" Right? And I thought, man, like, this is super dangerous. I think people underestimate even the most honorable person will lie about their firearm if they feel like it's potentially going to be taken from them. And that's what you don't want, right? I'm just like a regular guy. And I remember like going into couples therapy with my first wife, and I was just super honest, maybe too honest. It probably destroyed my marriage. But my theory was, if I'm going to lie to this person, I'm never going to be able to get the help I need, or fix whatever the issue is. And when you kind of create that barrier, now, say someone does have suicidal ideation, but their firearms is the only thing that's keeping them here, because when they go to the range, they like to shoot and they focus and they don't think about anything else in life. There's no stress. They're dialed in. And then you have a therapist who has kind of come off as like judgmental, or I could potentially take these things. Now you've taken away the ability to really help this person with something they like, because it's almost counterintuitive, right? You think of somebody who has suicidal ideation and firearms bad, but in our world, it's not. It could be the thing that saves somebody's life, like Jake and DB and you. Yeah, like you guys could all say, "I want you to go to the range and shoot today." Like, your anxiety's high. I think you should go shoot. Focus. Like that I think lying about this or creating these barriers is just as dangerous. And nobody studies this stuff. Like, that's the problem I have with the academic side of things. They always study the negative of a firearm, like the actual negative outcome, but they won't study how many people avoid care because they're scared. And I think we need to put more emphasis on that side of it. We need to find out how many people are lying. Have you ever lied about your firearm instead, or avoided care? Like, that would be a great thing to understand, just to know how big that number is. Because in my world, it's pretty massive.
Yeah, Emmy Betts, who's a emergency medicine physician out of Colorado, who's a good friend of our program, she has conducted some research to that end about who lies on intake forms at doctors' offices, and the number is large. I'm not going to quote it because I'll get it wrong, but it was as you expect. It's very high. So we do have some emerging research on that. We also have some people, Paul Santilli, who's a military social worker, clinical social worker. He's written a paper. It's very good. We had him on our podcast. It's called Guns and Mental Health, if anybody wants to listen. And Paul basically took empirical evidence on how you assign homework to people to help keep them well, right? If you interview somebody, you get to know them and they love running, you say you should probably keep running. Don't stop running. It actually combats your depression, your anxiety, whatever. If you find out that somebody really enjoys shooting, you should prescribe that. And I can imagine some of my people, going back to me like, honey, got to buy more ammo, Jake's orders, which is great. But Paul wrote this paper and it basically walks through all the components of gun training and how those same concepts, the focus, all the stuff that Mike talked about, the focus, the distraction avoidance, the concentration, the breath control, all this can play into being quite therapeutically advantageous. Can't find anybody to publish it. And he has tried and tried and tried and tried, and nobody wants to publish it because it's quote unquote pro-gun. It's sad, but we should be exploring this. And Mike's got stories upon stories about people who say, if I didn't have my guns, I wouldn't be here today. Now, there's also people who say, if I had my guns, I wouldn't be here today. And that's fine, but we have to acknowledge the both and of that. And, listeners are going to be well aware of the dialectic. It's a both and we would be wise not to cast away the positive of firearm ownership in deference to the negatives or the perceived negatives. And one more thing, it's not just the rights restriction. It's not just the property taking. There are people who utilize these tools for their occupations, police, private security, military personnel, and having that restriction just even looming is enough to make them care avoidant, not to mention the possibility of getting back to command staff, telling them that they're unwell, firefighters, like any real first responders, medical personnel who, if it ever got back to their supervisors or their command structure, the culture there may not be quite as welcoming as we would like it to be. And so confidentiality unto itself, set the gun aside for a minute, is threatening enough to keep people away from care. And to Mike's point, nobody studies that either. We're trying. Walk the Talk's done 3 different surveys now with varying response levels. The highest was like 2,400. We did one recently with like 1,100 responses. So that's a pretty good N of gun owners because we distributed the survey through our channels. Guns.com has a very large email list. And so it's an imperfect internet-based self-select-in survey, but the survey results are quite striking that there's a large number of people who are specifically avoiding care because of these perceived threats, real or perceived. And my hypothesis is that's actually making the suicide problem worse. It's certainly making everything else worse. I mean, if your mental illness gets worse because you don't seek care, because you perceive that your life's going to be in ruins for simply filling out the form and going to the appointment, then the suicide prevention efforts are not working. The policy interventions are not working. They're actually causing harm, and that's unethical. So I think we need more research to substantiate or invalidate my hypothesis. But so far, it's anecdotally, and our research is suggesting that the red flag laws, the ERPO laws, they're actually deleterious to care access.
So we touched on this a little bit, but obviously the worst case scenario would be taking someone's guns away, calling in sheriffs. That's something we want to avoid. What are some signs that you would see in a client that might signal that you should tell them, hey, you should find a friend or a loved one, leave your guns with them temporarily for a few days? What are some signals you would look for?
I want to kick this over to DB in a second, but I want to jump out in front of this and let everybody know that I think we're up to like 27 states now. Maybe it's 22. I can't remember, where there's a law in the books that doesn't allow that to happen at all. It's called a background check law or a transfer law that doesn't allow you to transfer guns to a trusted individual outside of family members. And that also is a problem because simply doing the right thing, even in the state of Nevada, Mike and I are both concealed carry permit holders. And I can't simply give my guns to Mike in a time of crisis without going through a background check. Otherwise, we both become, in Nevada, we have this gross misdemeanor, which is in between misdemeanor and felony, but most states don't have that. Most states, you just become a felon. So trying to do the right thing is obstruction itself because of this law that's present. And there's time considerations, financial considerations, background checks cost money, and time is of the essence when somebody's in crisis. So we're presuming a lot in forcing people to go through background checks to transfer firearms in a time of crisis. I will say most laws have a carve out exception for, something approximating a good Samaritan, but then they also wrap it in time limitations, and those time limitations are not necessarily clear in the statute. So it's like, how long could Mike even hold my guns? We don't really know until it gets to court and a judge decides if it goes that far. But we don't want to be in a position where it's like, well, I held him for 90 days and judge is like, that's way too long. that's well beyond exigency, right? So beyond that, we're making assumptions about income levels and the ability to pay for such fees and all sorts of stuff. So I just want to say that first before we get into the signs and symptoms thing. But DB.
Yeah, I'm glad you brought that up, because that was my first thought as well. I've been stewing on when do we bring that into the conversation. That is a rational and understandable response would be to, hey, somebody who also is a firearm person, trusted friend. Can you hold my guns for me? I just don't trust myself right now. I've heard that a number of times, and I've heard it through others, a lot. But so there are barriers in at least 27 states, and just as Jake said, you're risking being a felon for a while at the best case, or being a felon forever if you get that wrong, and it's an untested concern. So signs and symptoms. I mean, if you've got a trusting relationship with your client, with the person that you're meeting with, I mean, hopefully this is a conversation that is fairly overt. Sometimes it takes a bit of ferreting out, getting a sense of, some of the baseline things being off, the conversation tilts in different directions. And so maybe kind of vague or more passive statements of like, I just thinking about, just not being here anymore. So I'll get direct statements like that. I suppose direct quotes just like that. They're fairly somewhat indirect in the nature of what they're saying. And so that requires, I would say, for the clinician to be curious, not to be presumptive, but to be curious. So tell me, the standard therapist answer might be, tell me more about that. But the point is to kind of have more of that conversation. Like, what? Yeah, I've heard you say that a couple times. Like, what's up with that? I mean, sounds like things are like last time we spoke, there was stuff in the marriage, and that's been pretty rough and grinding on you. And you've had some financial stuff lately, and like that's a lot. And so I'm really looking at establishing, is this a serious concern? Is this frustrating? Like, what level of this? I mean, Jake mentioned kind of 8 out of 10. Yeah, I'm kind of getting a subjective assessment of where we are. And, the statements I just want to, kind of, I'll say it because this is a group that understands this, and I'll assume that the firearms industry, I'm well aware that they're familiar with this phrase, but, kind of pistol to mouth kind of phrase. I won't even say it, but kind of. So that's something we throw out sometimes, and kind of a humorous thing. But for a therapist, it should never be a funny statement. It should be all right. I don't assume that people float things out there just to be humorous. I assume that they're testing the waters. How am I going to respond to this? Am I just going to pass it off and be awkward about it? It's not helpful. So I need to be inquisitive in that. So I want to get a sense of, what's really going on. And it is fine to have these thoughts. It is absolutely okay to air them in front of me. In fact, I think that's incredibly helpful to hear yourself say the things that you're thinking. There's something incredibly powerful, both preventative and predictive, when we say things out loud. So I've heard so many times when somebody has said these kinds of things and they say, gosh, I can't believe I even said that. Like I'm so frustrated with myself for even having said it. It sounds ridiculous. And but great. So we're getting somewhere, that the person's been able to hear, how dark and deep they've been in their mind, but it's just been festering, and it needed, just like wound care, it needed to get scrubbed out, exposed to the light, exposed to some oxygen and some antibiotic to get in that stuff. And so the stuff that's going on in our mind is very similar. Mike, yeah.
Yeah, I was just going to say, Ryan, I think it's also important that we talk about the other end of the spectrum when it comes to this. Earlier I talked about Bill Strominger. That was my friend and president of my company that took his life. And I think we all want to see symptoms, right? Like, and we do that after the fact many times. We're like, well, was that a sign? Was he giving me something? And I can honestly say that with Bill, he had no symptoms. He was showing no signs. There was absolutely nothing. The night that he took his life, we were playing basketball earlier in the day, and I had to catch a flight from New Jersey back to Vegas. And I remember as I was leaving, he was asking me, hey, did you make your reservation for this trip we're supposed to go on? We had like 6 trips planned for business. And, I kind of looked at him and I was like, maybe. And he's like, I'm serious, Mike. He's like, you need to make your reservation. And I remember he told me as I was like walking out of the gym, he goes, I'm going to be really pissed if we're not staying at the same hotels, because a lot of the trips that were going on for these shows, right? So he's talking to me about the future, and we're laughing and we're joking, and there's not a sign. And then he takes his own life later on that night because of maybe an incident, or maybe he always had that thought. He just, once again, this is a guy that said suicide is the coward's way out. It was very tough for me because a lot of people came to me because I had spent so much time with him, especially his family members, saying like, hey, what did you see? Or kind of looking for clues. And I had to disappoint them. I had to say like, I'm sorry, there's nothing. And then they pull me aside privately, say the same thing. So I think it's important that if you're a gun owner or you have a friend or a family member that has a gun in the house, to understand that there might not always be signs, but that's why it's so important to have a plan in place for this type of thing that you can talk about. And I'm not plugging this. I don't like doing that, but on our website, we do have a mental health plan for gun owners that basically goes over some basic questions about what is the plan for your firearm if you have a child that has suicidal ideation or that's in crisis at the moment, right? What is the plan if you start showing signs of dementia? And you can have these plans with a trusted friend or family member already in place. So you might be more apt to say, I'm not doing so well right now with my divorce. Ryan, can you just hold on to my guns? Let's kick that plan into place, right? And maybe you're like, wow, I didn't realize Mike was that upset. But I think we also have to say, like, don't put a burden on someone to say like, you have to spot these signs all the time when there's not. I mean, I remember I did not handle that well, because I felt like I got to give people something, like, and did I fail? Did I miss something? And, over the years, I realized like, some people suffer in silence and they're very good at masking it.
This dovetails into something that I would like to push back on, which is that suicide is preventable. Now, that may sound unorthodox. I've learned over the years, and I'm not going to name names, but people that we've spoken with have helped me change my mind on this. If you conduct a survey of any random set of people, an overwhelming majority will say suicide is preventable. Now, at its core, I do believe that that's true, because given a series of circumstances at any moment in time, yes, we can stop people from taking their own lives. However, what that does is the motif or the understanding or the presumption is that because it's preventable, it's someone's job to prevent it. Now, in my emotional functioning, when I teach that sadness is having your expectations not met. Shame is creating sadness in another person, meaning you didn't meet their expectations. Now, if the expectation is that suicide is preventable, then someone somewhere, if not many someones, are responsible to fulfill that expectation. And when the expectation doesn't get fulfilled, who's responsible? So we end up with this shame that ripples across the community, and it's completely irrational. So it goes to the last person to talk to, or the last few people, or, the concentric circles go out to friends and colleagues and coworkers. What did you know? When did you know it? How did you respond? Who's responsible? Right. And the fist goes in the air, because what we want is to hold people accountable. We want to close the loop on the shame and guilt. We want to explain it away. And sometimes there's just no explanation. So I caution people to hold loosely to that idea. We want to make sure that we're still believing that we can stop people from taking lives, selves or others. And also, it's not necessarily anybody's control except the individual. So that's one key point I want to make. But for me, you're asking about signs and symptoms, presuming this is in the office setting and we're professionals here. Somebody cleared their throat and raised their hand and signed the consent form, and they want treatment. They're sitting in front of me or DB or you or whatever. And for me, yes, you can go through any suicide intervention training. They'll tell you to look for, future orientation and changes in, like the delta, so to speak, the change in mood from weeks ago to present day or whatever. You want to look for trends and patterns. You want to look for loss of interest or pleasure in one or more things. You want to look for overly anxious worry about certain things to the point of getting overwhelmed, that they don't think they can take control anymore, that kind of stuff. Okay, fine. My concern is actually with the youth. Youth don't necessarily have the vocabulary or the development to articulate what's going on. And given age and circumstance and turbulence in the home, they may not want to share that either. They may not trust anyone. So we have to be very tactful and diplomatic and skilled in how we ask those types of questions with the youth. But also, if we find out that youth is in a home with firearms, we have to also involve the parents. And I know that clinicians aren't really, some of them, I love working with kids. It's like, yeah, well, you better work with the parents too, because as go the parents, so go the rest of the home. And we have to pull the parents in and have that sober conversation too, and say, I think your kid's on edge. We're gonna solve it, but in the meantime, we need to lock up the dangerous objects. Where are your firearms stored? Now, one of the things that Walk the Talk America has been very good at is changing the dialogue and the language around storage. So it used to be, are you storing safely? Well, safe is very subjective, and it became very watered down during 2020 because it was like everything had to do with safety, right? And so now nobody knows what it means anymore. So we've invited people to change their language to describe firearm storage as responsible storage, defined as preventing unauthorized access. So responsible firearm storage is preventing unauthorized access. And who's unauthorized? Children, for sure, which means you can't have it loaded in the nightstand unsecured with no, some of them with no holster, but with no locking mechanism to prevent access. Who else is unauthorized? It could be the person who, smashes your window and breaks in when you're not there. It could be you in a time of crisis. So if you are unauthorized to have your own guns, we have to have that conversation too. But having a conversation with gun owners about responsible storage at any time is a good conversation to have for clinicians and also for the gun community. And we've had really good discussions with firearms owners who are like, safe, secure. Why do we need this responsible? It's like, well, let's get terms clarified. If we say responsible storage is preventing unauthorized access, nobody disagrees with that. We can swap words in and out. That's fine. But the point is to prevent unauthorized access. And they go, that really makes a lot of sense. Yeah. Okay. Check your firearms, because gun people think they're the safest people on the planet quite often. Like we emphasize training, we emphasize safety, the 4 rules, the 3 rules, whoever you talk to, that it's like if you adhere all the rules of gun safety, nobody's going to die. That doesn't always happen. So you ask somebody like, hey, are your guns stored safely? Yeah, absolutely. Very, very safe. Safely tucked around every corner, in every couch cushion, on top of every appliance in case ISIS kicks in my window at 3 a.m. I am going to be very safe. It's like, but is that responsible? It's like, well, So then we have to have a different conversation. So when the grandkids come over to the guy who's, got 17 guns staged around the house, loaded, chambered, but not necessarily stored responsibly, maybe we need to store them a little more responsibly when the grandkids come over. So those are conversations anybody can have. Professional therapist, firearms owner, non-gun owner, friend of, like, you could just say, hey, looks like you're a little off. I know you're a gun guy. I'm not a gun guy. Are you storing responsibly right now? And then that at least sends a meta message that I care enough to ask. And let's deepen this discussion a little bit.
Well, Jake's bringing out an important piece with it. Gun legislation, part of that is in storage, right? So all firearms, an example, must be secured within a safe, maybe even separate from ammunition, depending on what state, or if you're in a more communist country like Canada, if you can still have a firearm.
Or the People's Republic of Oregon, like you.
Yeah, or the People's Republic of Oreganistan, yeah. So but that flies right in the face of why a person might be wanting to be more prepared. And so so what responsible becomes really the important part. So the gun industry is going to, understandably, most gun guys and gun gals who have a firearm for self-protection, self-defense, are going to recoil at the idea of their firearm being locked in a safe in another room and unloaded. I mean, that's an entirely useless firearm in a self-defense situation. But responsible firearm ownership would be, and there's so many great manufacturers these days who are making very quickly accessible, whether biometrically or any number of other coded resources, that now that argument of is it accessible to me and inaccessible to others is pretty well gone away. I mean, I have several different locking styles that I use in different settings that allow me to have just about as fast, I mean, I'm talking maybe a second different, maybe, of access to my firearm. And that's a game changer, because now I can responsibly store the firearm and have it readily accessible when ISIS comes through the door.
So I've got
Mike,
two questions. Oh.
I want Mike to say his phrase.
Yeah.
You know what I'm talking about.
Which one?
The practice retrieving.
Oh, yeah, of course. Yeah. I'm still going off the ISIS comment, which I always love when ISIS kicks down the door at 2 a.m.
Hat tip to Rob Pincus for that one, by the way.
Yeah, absolutely. Yeah. As firearms owners, we pride ourselves in how much we train, right? We're constantly bragging about the pistol course, the AR course that we took, 3 days, shot from a car, all these things. But then when it comes to retrieving your firearm, we act like you can't do it. Like you can't train for it. So we always say, like, train as hard retrieving your firearm from your locking device as you do training with your firearm. I have children. They're older now, but I still I would never trust anybody. I don't want my firearms stolen, and there's plenty of people that come in and out of my house. So I have to have staged firearms locked up around my house. But I have quick access safes. There's not a room in this house that if I was stuck in and if ISIS came through the front door and I was in the kitchen or the master bedroom upstairs, like, I have access to a firearm, but they're all locked up safe. But I train retrieving them. There is a firearm right now at my desk in my studio. I have a quick access safe. I constantly run my fingers over it. I make sure the batteries are charged. I'm never going to get caught slipping, so to say, because I put some energy into it, and it doesn't take a lot of time. So train as hard as you do retrieving your firearm from its locking device as you do training with your firearm.
So I got two questions left for you guys. And the first one is, someone might be watching this and could say, it sounds like guns cause a lot of harm. Why don't we just ban guns and then all the harm would go away? What would you say to that?
You live in a cartoon world, as Dr. Christian Conti would say. the Christian Conti drinking game. Yeah, that's never going to happen. Once again, I'm going to just go back to the story I told about the 60 to 80,000 guns. That genie's not going back in the bottle. I understand why you say it. I understand why the person would say it, but it's not realistic. And I'm not about living in an unrealistic world. And I think that's the biggest issue that we all have with feel-good legislation. Like that's one of the biggest issues I think that the firearms industry faces is we have a hard time articulating why that's not going to work, right? Like what this feel-good legislation is going to do. And we know that it's actually not going to save one more life. So we kind of just throw our hands up and walk away from it. But for the person that says that, I understand where you're coming from. I love harmony. I love peace. But really, also, I question, what is your threshold for death, right? Like, do you really care about people dying, or do you just care about guns? Because cars, hammers, knives, which if you could wave a magic wand and make all guns disappear, they would just move to the next tool. Now, I know people don't want to hear that, but it's just facts. I care about people dying. I hate to see it. I just specialize in firearms because I'm from the firearms community. So that's my take on that.
There's an excellent article that just published this week from a Substack by a gal named Holly. She goes by Holly Maths Nerd, and you can look up Holly Math Nerd on Substack, and it's called The Reality of Nationwide Gun Control. Holly is not from the 2A community. She's a mathematician, but it is so well written, and she goes into all the stats. But I'll just say this, to Mike's point about the cartoon world. Cartoon world is not a judgmental statement. It's just a statement of fact. Like cartoons are not reality. Reality is reality. And I say this in our training on the website. We have to meet the issue where it is, not where it could be someday, not where we think it is elsewhere, not where it used to be, right where it is. And right where it is now is there's like 400 million guns in America. So let's pretend that the politics all aligned and the stars are in harmony, and we get Congress to get 2/3 passage, and then we get all 75% of state legislatures to amend the Constitution. We strike the Second Amendment, and then we enact the enforcement and the confiscation. You're just never going to get it. It's just not possible. So wand time, right? Those of you who are in the therapy community, solution-focused brief therapy is the magic wand question. Is like, if you waved a wand and you woke up, what would be different, to make your life better? All the guns would go away. Okay. That tells me that the individual has a problem with the gun and not the problem with the root cause of why the gun is used nefariously or negligently. And that's another language thing too. We don't say accidental, we say negligence, because negligence invites personal accountability. So what are we doing about the root cause? I think that's a much more difficult question. It's much less politically expedient to decide to reroute resources at whole communities that need uplifting, and you won't see the results for 20 to 25 to 30 years because election cycle is 2 years from now, right? Like that's a much more challenging conversation, and it doesn't beget feel-good legislation. Feel-good legislation is, ban guns, restrict guns, control guns, background checks. It's like, okay, let's ask what the goal is and put it into an actual therapeutic or medical model template. You got a problem, too many gun deaths. Cool. What's the goal? Reduce the gun deaths, I would assume. But then beyond that, are we actually asking about gun deaths, or is it all of this? And then we do objectives, and then we do interventions. But right now we've got a problem, and we jump right to intervention, and we don't know what the goal is. So I think we have to meet the issue where it is. And we obviously default to education over restriction. If you couldn't pick up from that, from our tone, that's what we want. We want education. We want people taking personal accountability. We don't want to rely on .gov to do it for us. That things go sideways when that happens. So we have to meet the issue where it is. It's just not, it's not a reality, unfortunately.
If we remove the 5, most largest cities in the U.S. that are the heaviest in gun control, if we remove those 5 cities from our stats, we move to 189th, per capita globally in our gun death rates. So we have 5 cities with the heaviest gun control laws that, within the nation that are, they are why we are, perceived, well, it's not perceived, it's why we're leading in numbers for per capita gun deaths. But without those gun control cities, it's an entirely different story. So that's just on the gun control as an ineffective move. And also on a bigger issue, just as Jake said, this is not about firearms. And as Mike said, it's not about firearms. It's about, we have a sickness within our society, and the evil does exist. And we're not getting upstream of that fast enough. We're looking at the mechanism and not the reason. And that's way less sexy in policy, to look at how do we reshape and work towards unity within our culture. That isn't as fast a process. It's nowhere near as sexy. You're never going to win an election on that. Although it's a good talking point, but to actually enact a legislation, it's just not. It's going to be a non-starter. But that is the issue. How do we heal as a people and come together and stop creating acts of violence out of disagreements or the other reasons, just out of a crime, looking to do harm to somebody else?
So as a follow-up question to that, as a therapist, obviously I have a lot of empathy, and it just feels like we have to do something. So shouldn't we at least agree we can ban the big scary guns?
I mean, that goes right to Bondi Beach. Bondi Beach was enacted in Australia with 2 bolt-action rifles, incredibly effective by 2 people who knew what they were doing. But ultimately, what's the definition? So I'll pin to other guys on this one, but Scary is such an odd word. I mean, I don't want to get shot by anything. I have zero desire to be shot by a 22 or a 9mm, a 5.56, any of the different calibers. I don't want shot by any of them. So it becomes this Trojan horse argument of, I'm going to lead with this, just the scary ones. But most of the legislations aren't targeting the most prominent firearm that's used. So that's an interesting truth.
Yeah, and statistically speaking, of all gun deaths, somewhere between 58 and 62% are suicides anyway. So how many rounds does it take to take a life in a suicide? One. So if we really want to move the needle on gun deaths, we have to tackle the suicide issue first, I would say. If that's something that a business owner would do, they'd look at the data and they'd say, where are resources best spent and best allocated? And that very much vacillates and changes across geography too. So if you go into like Wisconsin or Wyoming, the numbers go closer to 75 to 80% of gun deaths. In some counties within there, that's 100%. They have no gun deaths except for the couple of suicides a year. And then in bigger cities, it's crime is the bigger proportion than the suicides. So we have to be sober in our analysis. If you want to be data driven in your decision making, then you have to use the data. Mike encounters this conversation a lot though, because he gets the what's with the AR question, quite a bit. So I'm going to kick to him.
Yeah, I think I always when people want to have that conversation, I welcome it, but I always say, like, after we're done here, I need you to either say, "I just wish all guns would disappear," cartoon world, or I have to rethink the way that I feel about this issue. Because what I always like to do is show them pictures so they can visually, like, I'll go on my phone. I have a couple things like queued up to where I can show the wooden rifle and then the AR, the scary AR. And then I'm like, which one, if you pass this law, this feel good legislation, you get it banned, which one stays, which one goes? And they're like, oh, the bottom one. And I'm like, no, both go. Right. And then they're like, what do you mean? So it's like, you kind of get people thinking, it's like, okay, it looks scary. Then I always ask one question. No one's ever been able to get it right, except for usually gun people. But I say, what was the worst school shooting? What was the firearm the person used in the worst school shooting in the United States? And no one ever gets it. They never do. But it's Virginia Tech, and the guy used two Glock 19s. And I think when you reframe it for people, they start to understand if they're genuine and they really are curious, right? And if they're stuck in their ways, once again, let's just go to Cartoon World and I'll buy you a beer. You know what I mean? Like, I'll go there with you. Like, we'll move on. But if you're curious and you really want to know, then you're going to ask those questions, and then it's people like us that are going to educate you, and you got to take that information in, and then you got to do something else with it, and then you got to understand, okay, this is problematic. Now I understand why. I had a documentary crew from Australia come out, and I took them shooting in the desert, and it was really, I mean, who knows what they're going to do with our segment, right? Like, they could chop it up any way they want, but I feel like they were, I feel like they have integrity. But they got it in real time. We sat there, we were looking at the firearms, we were going over, and it was kind of fun watching them say, like, okay, we didn't understand this. And I remember one of them said, why is it in the media? Why is it so hard to get this knowledge over on to somebody else? And I'm like, I don't know. We just do a horrible job of it. Seems like it breaks down. And I get it. Like, I don't know anything about golf, right? So, like, if you guys all started talking about golfs and clubs and different types of things, I probably would tune out too. I think it's just, once again, it's feel good legislation. People run with it, and it's not going to save one more life. And we know that, and that's why we get frustrated.
All rifle deaths, by the way, as a percentage of gun deaths, are below 3% on any given year. And the semi-automatic rifle deaths are lower than that. So typically it's
the AR, Jake, if the FBI statistics is less than hands and feet.
Yeah.
I mean, a lot of people don't realize that.
It's like 1% of all gun deaths are done by an AR-15.
Wait, am I getting you right? The number of people killed by an AR-15 is less than people who kill someone with their hands?
And
Correct.
feet. Yes.
Oh, wow.
And feet.
That's the FBI statistics. So, I mean, you know, it's pretty mind blowing if you think about it.
In the UK, by the
once
way,
again-
when they banned guns in 1997 or 93 or whenever it was, they gun deaths actually went up. Coley and Noir did a recent takedown on that on his show on his channel, so you can look that up if you want. And it was not small; it increased by quite a substantial number. Hypothesis is that the bad guys knew that people were unarmed.
It's the same in Australia, and I'm just so baffled with government trust or trust in institutions at such a low point. Why would anyone of any political stripe, if your team's in power right now and the other team's going to be in power next, why would any individual want to give up their ability to defend themselves? And we've all seen the movie, right? We've all seen the different shows and dystopian futures, and I think most people have a general sense that things aren't going well. So I'm baffled why we'd ever sign up to disarm ourselves, regardless of political stripe.
So my last question is kind of a twofold, and that is, what do people in the gun community need to know about mental health that you think they're lacking? And what do people in the mental health community, the therapy community, need to know about gun owners that you think they're lacking?
Well, I'll kick it off. To me, I wish people in the firearms community would take the time to learn what a therapist can and cannot do in their particular state. I feel like a lot of times, especially with things like ERPOs, it's like a one blanketed boogeyman that's the same for everybody. And that's just not it. I mean, Jake has watched the evolution of this. And when Jake first came to WTTA, he was like, we can't even take your guns in Nevada. And it was fun. It was fun watching therapists in our cultural competence course even think about how they would take somebody's guns. So not every state is the same. And I think gun owners need to understand that. Not every ERPO is the same. And I think gun owners need to understand that. And what I would say for clinicians is they need to open their mind to how important firearms are to the general public of the United States. I don't think people understand that the Second Amendment is something that people will just strictly vote party for. That guns mean a lot to somebody. That it represents freedom, it represents protection, family, all the security, everything, right? And people hold it near and dear to their heart, and they might be left on every voting subject, but they're going to stay over here because of the Second Amendment. And I think when people understand that and they appreciate that there's so many reasons to own a gun, because that's the one thing I get all the time. Why does anyone need to own a gun? It's like, why does anyone need to own anything? Why do you need to own makeup? Like, technically, why do you need to own it? You don't need it. Right. So we could do that all day. But when people understand how important it is to our community and that we're a very large community, I think that they might change their tune on how they approach firearms in general.
Yeah. And in terms of how do you get your head around, a client who may be a firearm owner? It really does come back to dropping as much as we can those preconceptions of how we cast this person, and we tend to do that poorly, especially if we're really ignorant of that person's cultural context. And it could be their dad was in World War II. This was handed down to them. It was this construct that was important to a family member, and that might be it. That might be the entire depth of why this person has a firearm, and that's an allegiance to this family member. And that's a fine reason to have a firearm. There's any number of others, but that might be kind of on the low level, maybe lowest level of firearm ownership. And yet I'm going to treat this client with disdain or distrust, and I'm going to go into that relationship. And that's a horrible position to begin as a therapist. My role is to get a sense of a person's world, regardless of their political stripe, and to look at the concerns and things that are ailing them, that are causing them distress, and how do we improve their life to a position that they'd be happy and vital, that the pursuit of happiness. How do I assist with that life, liberty, and the pursuit of happiness? I firmly believe that's my role as a clinician. I don't create that in a person. I might be some little blip in fostering their story moving forward. And my role is absolutely not to get in the way with that based on my own political bias. So I meet with tons of people I vehemently disagree with politically. But my role is not to sway their ballot. That's not my job. I'm not in a social advocacy role as a clinician. My job is to meet person to person with another soul and assist them along their journey to the degree that I can. So that's going to mean dropping a lot of my biases and holding on to some that I have this sense of like, this could probably be helpful, but I have to do that playfully, cautiously. And then what I wish firearm owners knew about therapists is that, well, one, there are a lot of us. There are a lot of us, and you can absolutely look around and find a better fit. Don't go with the person that's in your town just because they're the one person. I tend to really look at experience. Is this person able to separate themselves and just, from where they might hold their perceptions and actually just have an honest conversation? So I'd say, like with anything else, go into this intake, the first conversation, with a sense of reserve, and like any other relationship, we're kind of sussing the other person out. Do your homework on the front end and be willing to switch. I think we can get that kind of, well, I've already paid for this first session, so I got to kind of stick with this guy. No, you're the buyer. You're the consumer in this. So switch. If it doesn't feel right, make a change.
Yeah, I'll throw in a little asterisk on that your insurance may not pay for 2 intakes or 3 or 4 during the course of a year. So, coding matters when you're billing insurance, but that point aside, that's far less important than getting somebody with whom you can relate. So to the therapists, to echo everything we've already said to this point, Ryan, you know better than anybody that how activist therapy has taken over our profession. It's disgusting and it's despicable and it's unethical, and I believe it's malpractice to push any view onto a patient who's not there for you; they're there for them. So that, unfortunately, I don't even think most students who've graduated in the last 3 to 5 years are even aware of it. Some of them are, and some of them do it proudly, and you can usually read through that on their bio and avoid those folks because they're not in the profession for others; they're in it for themselves. So get out of the activist mindset. We're not trying to sway ballots, and humble yourself and learn more and realize that this demographic called gun owners probably includes people like you. Whatever you think you are, you're in the community, and that really helps alleviate a lot of judgment. So that's what I would say to the therapist is learn more. Just continue to learn and humble yourself and take a one down position of not knowing so that you can receive new information and grow. And to the firearms community, I say the same thing to gun owners as I say to everybody else. It's going to sound heretical, but I don't mind that because I've been a heretic in this profession for many, many years. You don't actually need us. So for like 40,000 years, humans have been in their current iterative form. We've been healing each other without us. We've been around for like 120 or something like that. And somehow humanity managed to exist. We managed to heal each other really, really well. So I say frequently, I'm trying to work myself out of a job. If you happen to come in here because you need a professional, that's fine. There's professional mechanics too. People have been fixing their cars forever as well. But sometimes you need a professional, and you should only be in the care of that professional for a limited period of time to solve your problem and then move on and then continue to solve your problems with the armament we give you in the form of knowledge and skills and tools and intervention strategies within your own kitchens and workspaces. So if you are suspicious enough never to reach out for professional help, I'm fine with that, but you better reach out to somebody. So have a network, have a tribe that you can open up to and be truly vulnerable. The only way we connect intimately with people is through vulnerability. Now, the vulnerability comes with risk. Risk of what? Pain. And if you're in pain, who wants more pain, right? It's hard to open up, but you got to have somebody. There is no such thing as independence. It's just a falsehood. There's no such thing as independence. We have interdependence, which is ideal. And then we have dependence, which is less than ideal because now you're relying on somebody else to fix you and solve your problems and provide for you and all sorts of stuff. So we want an interdependent flow among our people. And if you find a therapist who's trying to make you dependent upon him or her, that's a good way to get out of there too. And if you if you're making the mistake of thinking that you're an island, you're not. There's no such thing as a man as an island. It just doesn't exist. So interdependence, rely on your community, rely on your family, rely on your, whoever you rely on. And if you don't ever want to come through my door, I'm perfectly fine with that. I will say that in the very, very near future, like weeks, not months, Walk the Talk will have a bulleted list of green flags, so to speak. And I'm stealing this from Jonathan Shedler, who came out with 50 red flags for clinicians. He also came out with 15 green flags, and we're going to turn our list into green flags. What things you can look for that are positive indicators that a practitioner is probably for you, so to speak. And we'll post that to the website so you can vet out your folks a little bit more quickly, and maybe from an arm's length, safety of your couch type of examination. So that's what I would say.
Awesome. I love this conversation, guys. Where could people go if they want to learn more?
If you want to learn more, go to WTTA.org or walkthetalkamerica.org. And if you want to find us on social media, it's at WalkTheTalkUS. We're on Instagram, X, LinkedIn, and Facebook.
If you enjoyed this video, be sure to check out my book, The Woke Mind, The Twisted Psychology of the Social Justice Movement, available on Amazon.